Hello, everyone. Thank you for joining me online today. And thanks to everyone who is following public health advice and celebrating safely. I hope you are all enjoying a healthy and restful holiday season. Staying apart from friends and loved ones is never easy, especially during the holidays. But at this time, it's essential that we all help prevent the spread of COVID-19. Having said that, I think it's important to acknowledge that for some Canadians, physical distancing is not that simple. Studies show that individuals from lower income, densely populated neighborhoods are disproportionately affected by the virus. Crowded housing conditions and restrictive costs can make it unsafe or even impossible to self-isolate, which increases the risk of community transmission. The Government of Canada remains focused on protecting the health and safety of Canadians and reducing the spread of COVID-19. As part of our growing list of rapid response tools, the government is providing over $100 million for municipalities to establish voluntary isolation sites under the Safe Voluntary Isolation Sites Program, or SVISP. This program helps address the needs of the most vulnerable populations during the pandemic. Today, on behalf of the Honorable Jean-Yves Duclos, Minister of Health, I am pleased to announce that through the SVISP, the Government of Canada is providing $8.4 million in funding for the province of Manitoba. This funding will support the expansion and creation of safe, voluntary isolation sites across the province, including sites in Winnipeg, Brandon, The Pas, and Thompson. We know that COVID-19 spreads easily within households. Safe voluntary isolation sites can help limit the spread of the virus and keep residents in our communities safer. Now, before I finish, I just want to remind everyone to continue following the layers of public health precautions to prevent the further spread of COVID-19. We all have to adhere to these guidelines to keep caseloads manageable. Getting fully vaccinated, wearing a well-fitted mask, hand washing, physical distancing, self-isolating if required. We must join with everyone in our communities to make a practical contribution. I personally believe that there's reason to have hope as politicians of all political stripes, different levels of government have come together to make a difference. Today, I'm so pleased to be joined with the Minister of Health and Seniors, Minister Audrey Gordon, and I'll hand it off to you at this time.
Thank you, MP Lamoureux. Good morning and bonjour, everyone. I'm Audrey Gordon, Minister of Health and Seniors Care in the province of Manitoba. I want to start by saying that I too hope everyone is healthy and safe this holiday season. And MP Lamoureux stated that not everyone has the option of a safe place to self-isolate if they get COVID-19. And that is why here in Manitoba, we have launched alternative isolation accommodations. So these sites provide a place for individuals to complete their required self-isolation period. And of course, this helps to reduce the spread of COVID-19. These sites provide a wide range of services, including meals, wellness checks, and healthcare supports if those are needed. And these spaces are an important part of our overall response to COVID-19, in addition to some of the other tools that MP Lamoureux mentioned, such as vaccination, wearing a mask, and practicing the fundamentals. These spaces are an important part of our overall response to COVID-19, and we appreciate this federal funding as it will allow our teams to provide this much needed service to more Manitobans right across the province. Voluntary isolation sites provide that option to people who may not have another option to self-isolate, which allows them to protect themselves, their loved ones, and their community. The success of these sites cannot be understated. There has been a great deal of work done to make these sites a safe place where people can rest, recover, and get well. Isolation is hard. Many people have made many sacrifices to both use and staff these sites. And I want to thank the Manitobans who have given up so much to protect others, even during the holiday season. And it's hard to leave one's family, but they made the choice to do their part to reduce the spread of COVID-19 and keep their families and communities safe. And I want to thank our teams at the sites for their hard work, dedication, and commitment to caring for Manitobans and helping us to slow the spread of COVID-19. Together, we can further slow the spread of the virus, again, by getting vaccinated and following public health guidance. And I encourage all Manitobans to do what they can to lower the number of close contacts they have and stay home as much as possible. This will further help reduce the spread of COVID-19 in Manitoba. And we can all do this by working together because we know that we are definitely stronger together. Thank you. Merci.
Thank you very much, Minister. And I think at this time, both of us are open to having some questions and answers or provide some answers. And what we'll do is we'll hand it over, I think it's to Audrey, who will recognize and put have demute, if I can put it that way, or unmute the member from the media that does have a question. All we do is we request that you raise your hand and we'll get you recognized to ask a question.
We see a question from Ryan Tumulty.
Yeah, hi. This question's for Mr. Lamoureux. I'm wondering, at this stage of the pandemic, given the rise in the number of cases, I'm wondering what other options the federal government might be considering in terms of support. I know you're offering boosters and rapid tests, but it seems like the pandemic, especially in some parts of the country, is really taking off. We saw 14,000 cases today in Ontario.
It's a good question. And I think the most important role that Ottawa needs to play is to be there and support Canadians in a very real and tangible way. And we do that in many different ways. But in good part, it's working with our stakeholders. Today, I'm having a press conference with Minister Gordon, who has a great deal of assets. We have assets, and by working together, we're better able to deal with the crisis in front of us. An example would be, the recent request from public safety, and as a result, we have healthcare professionals through the Red Cross that are being deployed to Manitoba. We have legislation that we just passed a couple of weeks ago to support small business sectors and individuals. So it's working with provinces and stakeholders, bringing forward legislation and budgetary measures that will be there to support Canadians. Today, it's about trying to minimize, and as Minister Gordon has so correctly identified, the vaccinations, getting vaccinated, getting that booster shot, so critically important. We all have a role to play.
Thank you, Ryan. I'll be helping out in the Q&A.
Okay, so can I do a follow-up at this point?
Go ahead.
Yeah, so the other question I had, I guess, is I wonder if the federal government is concerned about the variety of different responses across the country. Some provinces have reintroduced restrictions. Quebec is talking about a curfew, but some provinces have imposed no new restrictions. Are you concerned that maybe some provinces aren't taking this issue seriously?
From the very beginning of the pandemic, the Prime Minister and the Government of Canada recognized the vastness of our geography and recognized the importance of working with provincial and territorial entities along with Indigenous leaders and other stakeholders. And this has been an ongoing process for us. And at different points in time, whether it's working with nonprofit organizations, an individual province, or other organizations or stakeholders, we've provided funds and other resources in order to try to make sure as much as possible we're minimizing the damage of the pandemic. There's always going to be areas of concern where we would encourage other provinces maybe to consider what another province might already be doing. But we do respect the fact that the provinces are closer in administering the healthcare to their individual or respective jurisdictions, and we need to work together. And I think it's important to recognize that we have different levels of government, different political parties working together to provide confidence to Canadians that we're doing the very best we can as elected officials to minimize the damage of the COVID and to provide hope.
Any other questions?
Hi, can you folks hear me okay?
Yep.
Yes,
Go ahead,
go ahead, Morgan.
Perfect. Minister Gordon, MP Lamoureux, thank you so much for the time today. Quick question, when can we kind of see this cash flowing to the streets of Winnipeg, the streets of Manitoba, in terms of actually helping those most vulnerable people? And what would your message be to the public about accessing these sites? You know, how can these sites be accessed essentially, especially by those folks who maybe don't have access to the internet or mobile connection?
I'm expecting the funds to flow virtually immediately. Let's get these sites operational. Our municipalities, with the support and encouragement from the provinces, are in a great position to identify locations, the people that are going to be required in order to be there for the setup, and the funds will be there when they're needed to be there. The money has already been allocated, and a number of provinces have already signed on to it.
And I'll just talk a little bit about how an individual accesses this service. So when someone tests positive for COVID-19, whether it's Delta, Omicron, or any other variant, they will then be asked about their ability to self-isolate. And if they state that they're unable to protect their family members in the place that they will self-isolate, then we will begin talking to them about the option of accessing these isolation accommodations, and they will be referred to a provincial intake process where we have a provincial intake director that manages all the referrals and then works with the individual to design a plan that will be suitable for their needs. So the locations of our isolation locations are not made public, so you won't see anything on a billboard or a bus bench or a recycling bin. This is something we want to ensure people's personal health information is protected. So we work individually with the individual once they are found to be positive for COVID-19.
And if I could get a follow-up, that would be great.
Go ahead.
Perfect. So how many sites can we kind of expect in Manitoba? Is that something that's been determined at this point in time, or is that something that's still being worked out?
Well, we do, with this generous donation from the federal government, we plan to expand the number of sites outside of Winnipeg. The final locations have not been decided, but we are in discussions about whether they will be in Brandon, Thompson. We want to ensure, as I've always said, that we're providing services closer to home. And so definitely we need to look at our rural and northern communities in addition to what may be needed here in the city of Winnipeg. And
if possible, I've got one last question. Minister Gordon, do you think it's enough, you know, from the provincial perspective, is this enough from the federal government in terms of actually helping these vulnerable populations here in the province of Manitoba?
Thank you for that question. The federal government has been a great partner in terms of supporting Manitobans during this difficult time. As MP Lamoureux mentioned, we put out a request for assistance in ICU nurses a few weeks ago, and the federal government was able to assign a number of nurses to our province to help us in our battle in our acute care facilities of this COVID pandemic. Some nurses are still arriving, but we're grateful for the support they've given in terms of that assistance. And then again today, in terms of the over $8 million for isolation accommodations, every little bit helps. I know it's a difficult time for all provinces and territories that are experiencing the fourth wave at the same time. So I know that the government has, federal government has certainly been very helpful to Manitoba in our fight against COVID-19, and we're appreciative of the funding that has been allocated today.
Any other questions? Erica?
Yes, hi, thank you. Erica Ibrahim, the Canadian Press. This one is for MP Lamoureux. I was curious, so I see that the Government of Canada announced funding for COVID-19 safe voluntary isolation sites in BC. This was a little over a month ago for Canadians and temporary foreign workers. And in that announcement, there was also an acknowledgement that for some people in Canada, they're at higher risk, you know, crowded housing conditions, et cetera, makes it hard or impossible to self-isolate. I'm curious, why is this funding only being announced now, since the government has known that these supports help those at higher risk?
I think it's important to recognize that the federal government has an obligation and has been working, whether it's with municipalities and provinces, to develop this program. I believe the total is around $100 million in funding that's being allocated for it. And we have provinces like Nova Scotia, Ontario, Saskatchewan, BC, and now Manitoba, where the program is being implemented. You know, it would be wonderful to be able to see it even continue to grow as we allocated the money for it. And it's only a question of time before it does just that.
Okay, thank you. And just one follow-up with respect to your comments about other provinces that will be benefiting from these funds. How will that work in terms of divvying up the remainder of the amounts? Or are there, for the municipalities that are interested, is it something where they would apply, or those agreements are already sort of in motion?
And knowing Minister Duclos as well as I do, getting the $100 million allocation for the program, I am sure that every dollar of that $100 million will in fact be distributed. And I think the first round is going and working with the provinces and the municipalities. And you know, at the end of the day, I suspect that the municipalities play a very strong role, whether it's going directly or through the different provinces or territories. But that full $100 million I'm anticipating will in fact be spent.
Chris Kitchen, go ahead.
Hello, good morning to both of you. I'm Chris Kitchen from the Winnipeg Free Press. I had a question that I was hoping both of you could address. It's on the heels of some statements made by Newfoundland and Labrador's health minister on the federal COVID alert contact tracing app. He was claiming that the federal government has quietly given up on this app, and it's no longer being updated. So I just wanted to ask both of you if you agree with that assessment. Do you feel, Minister Gordon, for example, that the federal government has given up on this app? And I wanted to find out as well if you both feel that Manitobans, that Canadians should continue to use the app, whether it's still an effective tool to stop the spread of COVID-19.
Well, Minister Gordon, if it's okay, I'll just kind of start off on that. I think it's important to recognize this particular application at its origins was meant to try to be there in a very tangible way for all Canadians, but it required fairly aggressive participation from the different stakeholders, in particular even Canadians. And you know, in order to be able to make it viable, I believe at the end of the day, to be able to maximize the benefits, I think it's probably better that we say, well, maybe it didn't work as well as it could have potentially. And it underlines the importance of why the different levels of government in particular need to be able to work together so that we can maximize the actual tax dollars that we are using. If there was more merit for the program and more participation, then it might be worth the additional investment. But let's not throw tax dollars when there's a need in many different areas that we could be allocating those dollars where it would be more effective. So in the ideal situation, it would have been wonderful to see the program move forward, but the take up wasn't high enough, but it emphasizes the importance of the different jurisdictions working together, I believe.
And I will add to that by saying that there are many tools in our toolbox that we will use now and in the future in our fight against the COVID-19 pandemic. I don't think it's a bad thing to have the infrastructure already created and in place, and to be able to expand the use of it down the road. I haven't personally heard that it's not being used in Manitoba or can share in the comments made by Newfoundland, but I certainly don't think it's a negative to have the infrastructure there. I was just looking at my phone as you asked the question. I have the COVID alert app on my phone and made that available on my phone the moment it was launched. So I think it's just another tool that we will use if it's not being used as widely as we'd like it to at the moment. It's there, it's built, and we can ramp up the use of that very quickly. So I think it's a good tool that we have as part of our fight.
Okay, thank you very much for answering that. Just one other question, and apologies if I've missed it. Just getting back to the isolation sites, can you tell me how many sites currently exist, and after this funding, how many sites will we have in the province in total?
Well, as I mentioned earlier, the funding will help in the expansion to add additional sites across Manitoba. So we're still in discussions in terms of how many we will be able to launch, but certainly we want to ensure that it's accessible in rural and northern sites. So we will continue those discussions after this announcement today, and we will have more to report very soon.
Yeah, go ahead.
Hi, this is Kayla. I'm from CTV News Winnipeg. I'm just wondering if there's any street outreach that's going to be tied to the funding announced today.
Well, Kayla, it's a good question, and I think at the end of the day, what we're seeing is community activists, municipalities working with the province as the federal government wants to be able to assist in whatever way it can. And one of the ways it can is by providing financial resources. And today's announcement of $8 million will hopefully assist in a meaningful way as the province administers and looks at ways in which it can provide additional services. So suffice to say, I don't think it rules it out, but ultimately it'll be the civil servants and the province that will play that lead role.
Do you have a follow-up there, Kayla?
No, that's everything from me. Thank you.
All right, thank you. Any other questions? I believe those are all the questions that we have. I'd like to thank the members of the media for participating, and also to the member for Parliament for Winnipeg North, Kevin Lamoureux, and the Honorable Minister for Health and Seniors Care, Audrey Gordon. Thank you very much. I now turn over to our host.
Many thanks. This concludes our event for today. Merci à tous.